like to invite Donna and Sam to put their videos back on. I'm really excited to have this whole new treatment talk series that really brings that patient voice. I'd like to introduce Ms. Donna Caldi, and then Mr. Sam Paolini is going to jump on in just a minute as soon as he gets his camera on. So welcome. This is really wonderful to be able to have you all share your experience. So we'll start ladies first. Donna, can you just give us a short overview of your journey through the chemotherapy space? You're on mute, honey. I need you to unmute yourself.
This helps.
It's okay. Thank you.
So in December of 2018, I was diagnosed with the predominant muscle invasive urothelial carcinoma, high grade. So I had to have the chemotherapy before surgery to remove my bladder. I was blessed to be able to be treated by the best at the best. I also am grateful to have been offered to be a part of a clinical trial, which added immunotherapy to my chemo regime. My 3-week rotation consisted of the cisplatin, the gemcitabine, and the nivolumab, 2 weeks on, 1 week off in 4 cycles. So in my mind, the additional immunotherapy medication offered another layer of potential cure. Dr. Sanpavde was and is so well-versed in bladder cancer treatment. When he discusses your options, you just know that you are in expert hands. 1 month after my last cycle of chemoimmunotherapy, I had CAT scans to determine my body's response to the treatment and whether the tumor had shrunk enough to have it surgically removed. It had. So on May 8th of 19, I had a radical cystectomy with concurrent urostomy. I remain bladder cancer free so far to date. While receiving the chemoimmunotherapy regime at Dana-Farber, I was given what they call supportive care medications through the IV. I experienced difficulty when given magnesium. That's one of the medications that you have to get during the treatment. It had to be administered very slowly in order for me not to feel extremely foggy and have significant visual disturbances, which made me very woozy and nauseated. I also would recommend that you discuss IV access with your oncologist. I was 60 years old in good general health with great venous access, but by the middle to the end of my 4-cycle treatments, I had very sore veins in both arms. I would recommend the placement of a portacath, discussing the placement of a portacath prior to starting your chemo if there is any question about your venous access. As far as side effects, my most significant side effect was fatigue. Obviously, it worsened the more chemo that was administered. Initially, I bounced back within a week, but by the end, I barely bounced back after the week break. I was fortunate to have been able to have a leave of absence from work. I could not have worked due to the fatigue. I also had friends and family that transported and stayed with me during my chemo administration. I often marveled at the other chemo patients who were able to get themselves there and back on their own. The nausea was easily controlled with the oral meds at home, as well as the meds that they give you concurrently with your chemo. I did not have hair loss. I had hair thinning, but you could just cut it short and gel it up and you could hardly see it. And thinking of long and hard about the long-term side effects that I was left with after my chemo, I do have a low-level ringing in my ears, but it does not affect my hearing at all. And funny too, when you got chemo, there was a little cart that came around and gave you like lunch. And part of the lunch, I was so excited, was Lay's potato chips. But now the thought of and the sight of a Lay's potato chip bag causes instant nausea. Those are my side effects long term.
Wow. Okay. Thank you so much. How about you, Samuel? What's your chemotherapy experience like?
See what's going on here. I got to excuse me. All of a sudden my screen just shows a telephone here. I don't know what to do to get the screen on. Boy, here we go.
There you go. Can you speak up just a little bit because you're a little bit muffled?
Can you see me now? I can't see.
We can see you.
I can't see myself on the screen. That's why. As long as you can see me, I guess we're all set. I was found out that I had bladder cancer in the summer of 2020. And at that particular time, I had come to work. I urinated blood. And there was a local oncologist that I knew. I went in to see him, and he's the one that found out that I had it. So when I realized what's going on, fortunately, I'm very close to Boston. And I said, I'm going into Boston for my operation. I'm not going to go to a local hospital. I called up Dana Pava, and I talked on the phone to somebody, and they told me it was going to be about a month. And then all of a sudden she said, oh, wait a minute, there's been a cancellation on Monday. I can put you in. Would you like it? I said, absolutely. Fortunately, I didn't even realize it at the time. It was with Dr. Guru Santabio. And so we went in the following Monday, myself and my 3 children. We sat down with them, and yeah, I had fortunately a whole sheet in regards to my situation, so he could read and see exactly what was going on. And he went on to tell me the different programs, and basically in my situation, he said, as he had said earlier, that he felt that chemo and then operating on my bladder, and he would also take out my prostate and lymph nodes. And he said we go through a chemo treatment for 4 months and then the operation. And as soon as I heard chemo, I said, hold on, doc. I'm 80 years old and I'm not going to go through it. I heard too many horror stories. I was really, really not going to do it. But he went on to tell me exactly what he said to you people, is that they've come a long way now, and that it isn't like it used to be, Sam. You won't get sick. So I listened to him, and I felt very secure with what he told me, and I agreed to do it. And I went on a 3-month program or 4 months, whatever it was. I think it was 4 months. It was a 3-week program. The first week was a long week. The second week was a shorter week, and then the third week was off, and that went on until the time of, I started in September and went on until approximately January. And at that time, as far as I'm concerned, personally, I've been very fortunate. I was never sick. They gave me the first thing you do when you sit there for your infusion, the first bag that you put in for you is a bag that helps you not get nauseated. And then they also give you pills. They gave us 2 sets of pills. And they said, you take the first pill if you feel nauseated. And then if that doesn't work, take the second one. Well, fortunately, I never had to I took the pill 1 time in all the period of my treatment. And I was never sick 1 time. I actually went to work every single day. And I only missed work the days that I went in to get my treatments. So actually, I did extremely well. I was very, very, very fortunate, as I say, never getting sick. The only thing I did do is I did feel a little nausea once in a while, and I care about this, but my best friend became Ritz crackers. And when I felt a little nausea, I'd take a few Ritz crackers, and that helped me out, and that was it. And the other thing that will happen, at least with me, is I lost my taste, my appetite. I did not have the appetite, and I still don't really have the same appetite I had before. It's better, but not like it was. I had probably 50%. I would eat what I normally ate. But I was able to eat everything, just not as much. So actually my treatment and what I went through was very, very fortunate. From the day I had my operation to the day to today, I have never, I'm living a normal life. And once you go through the treatments, and as I say, and once you get it done, and the chemo, to me, again, I'm repeating, I had no problem whatsoever with it. It was fine, and I can never complain. I said, Dr. Kantabi is an angel as far as I'm concerned, what he was doing with me. So I really, just a funny story. It was during Christmas time that I was going through my treatments, and my family came over, and we all shared presents. One of my presents was a box of Ritz crackers. I always got a big kick out of that. But I know a little, I basically, I don't know how much more I can tell you. The only thing I can say is that the Dr. Kantabi, what he did as far as my treatments are concerned and what I went through was excellent. I had no problems whatsoever. As I said, I went to work every day. I'm repeating, I know. And I live in a normal life, and I'm living a normal life now. And as far as after the treatment is concerned, and after he did my operation, I've as I say, I've gone to work every day since I had the up. I was home for a while, and then I'm going to work every day now. I'm living a very normal life. And I again repeat, I thank Dr. Santabi for everything he's done. And basically, that's the summation of it. It's quick and fast, but I'm just telling you, people who are out there, not to be. I know you went. I was nervous when I went in there, and my family was nervous when we went in there. And it turned out to be exactly what the doctor told me, that you will go through it and you won't have a problem. At least with me, that was the case. And that is my story.
Well, Sam and Donna, thank you for sharing. Sam, I have a question for you. Can you eat Ritz crackers now?
No. I mean, not. I can eat them, but I don't anymore. No.
You don't want to eat Ritz crackers, just like Donna doesn't want to eat potato chips.
No, that doesn't affect me in that respect. No, they were my best friend. I'll tell you, I would feel lousy, and I would just open up that 6 crackers, have 3 or 4 crackers, and then my stomach would calm right down. And I was very fortunate in that respect. I had no diarrhea. I went to the bathroom and then on the basis. The only thing that's right. The only thing I did do, I have to mention, I don't know if this is unusual, is I put on 18 pounds of fluid. I mean, I weigh myself every day. I always have because I've exercised most of my life, and I always was used to weighing myself. But just one day, all of a sudden, I got on the scale and a pound a day. Every time it came off every pound. 18 days later, I was back to my normal weight. So that's the only really thing that really happened to me that was anything different than prior to having the operation.
Right. Well, this is good. So let me just ask a general question first. Is there anything that you, as patients, wish you had asked or been surprised by in this treatment as you were going through this decision-making process? Because you didn't get to choose which chemotherapy treatments you were on, but as you were going through, is there anything you wish you had asked as a patient that perhaps you think other people should think about and ask their doctors about?
It's a good question. No, because when we sat down with the doctor, it was a pretty lengthy situation, and because my family was there, we were also aggressive at it. And when I left there, we pretty much had everything. I mean, it was pretty cut and dry, basically. He said, this is the best way to treat this situation. I said, is there any way? I said, can you cut out what happened with me is I had 2 cysts in my cancer. One cyst was not cancerous. The other one had gone through into my outer layer. So I said, can't you just cut it out? And I said, and just give me the treatment. And the doctor told me that, Sam, he says, my job is to do the best thing I can for you. And the best thing to do is remove that bladder. And removing that bladder and removing removing your prostate, and also removing the lymph nodes is going to give you the best chance. And in my situation also, a couple of weeks afterwards, doctor called me up. Sam, I got great news. And I said, what's that? He says, you're completely cancer-free. He says, everything that was in there is gone, and you have no cancer in your body. And just this past week, I just went in because I go in every few months, and now they check me. They give me a CAT scan and blood work, and came back. The doctor called me and said, Sam, everything is fine. We found nothing different in your body. So it's been a year. I'm 81 years old now, and I'm living a normal life. I'm calling you from work right now. I mean, really, I keep repeating. People ask me, how are you doing, Sam? I said, I'm doing everything. The only difference in my life now, I mean, I hope you don't get offended by what I'm going to say, but I pee in a bag instead of peeing out of my penis. Really, and that's the bottom line, really. And that's, other than that, I'm living a very normal life.
Okay, great. Donna, anything to add before we open it up for questions from our participants?
Well, the only thing I would add is that I'm sure most people are probably like myself, and your mind spinning around, what's going to happen to me and what's going to go on. And as I said, earlier you heard from the other participant, and she was fatigued, and it affected her in a different way. But in my particular case, as I said, I'm being very honest with you. I never missed a day of work other than the day I went in to have my treatment. Never got sick one day. Went out to eat, ate everything I normally would eat, just could not eat as much of it. And as I say, I thank God every day. I really do, and he was very good to me. And uh, I
Mhm.
like I just don't know what else to tell you other than the fact, as I say, I'm sitting here talking to you and I'm living a normal life.
You know, it sounds like you and Donna were both very hardy New Englanders, that you really did make it through the chemotherapy with flying colors, you know, and maybe that's a New England thing, a Boston thing, but I know that not everybody can go through as smoothly and as easily. Donna, did you have anything else to add before we open it up to questions from the audience?
No, I just wanted to reiterate the fact that, given the fact that gemcitabine is so caustic to your blood vessels, you should really talk to your oncologist about a portacath prior to the treatment, because it really was very sore. That's all.